Hi, my name is Teri Riley, and I'm the billing supervisor here at Dominion Fertility. And this is Liz Ramirez, financial counselor. Welcome to What's New Wednesday. Today we're going to give you some helpful information regarding insurance coverage and infertility services.
Insurance can be very complex, especially for an individual that isn't familiar with the terminology. So just because an insurance plan states they will cover infertility doesn't necessarily mean that they will pay for your treatment.
Exactly. Plans that cover infertility treatment sometimes have criteria that must be met before they would allow the patient to utilize the benefit. For example, most plans require that the patient meet the medical definition of infertility, which states that patients 34 and younger must be actively trying for at least 12 months, and patients 35 and older must be actively trying for 6 months.
And even if you meet the definition of infertility, there are a lot of plans that require you to meet certain guidelines, so before even being approved for coverage. For example, there's a lot of Aetna plans that have strict criteria and require a patient to undergo less invasive treatment options before even considering approving or paying for IVF. Some plans nowadays require your blood hormone levels to be within a certain range, so we guide you through that if that's the case.
Yes, and also some plans require that the couple be married. They require the use of the female's eggs or the spouse's sperm. And there are also some plans where they require, if there's been any history of voluntary sterilization, they would not cover the patient. So if there's been history of the patient having a tubes tied or the male having a vasectomy, that would negate all coverage for infertility services.
Yeah. So once you're scheduled for a new patient consultation, we do a verification of your insurance benefits as a courtesy. You are then assigned to a financial counselor who will contact you to go over your insurance benefits in detail. And of course, that's a great time for you to ask any questions. Unfortunately, at times we are misquoted, so we encourage and we sometimes even stress for our patients to contact their insurance directly to familiarize yourself with your benefits. And it's important to ask the right questions. One question is the deductible. A deductible is a amount of money that you must pay before your insurance will start paying on claims. Deductible normally runs on a calendar or a contractual year, so it's good to know those dates so that you can maximize your benefits early on.
Yes, and some plans require patients to pay what's called coinsurance. Now, coinsurance is the patient's responsibility after insurance has paid. So let's say your plan covers at 80%. Then your patient responsibility or coinsurance would be 20%. And then there's out-of-pocket maximum. That is the maximum amount that you would pay out of pocket for that plan year. So it's really helpful to know your out-of-pocket maximum, because once that out-of-pocket maximum is reached, then the insurance kicks in and covers at 100%. And with the out-of-pocket maximum, the deductible and the coinsurance typically applies to that maximum. And then there's also lifetime maximums. Lifetime maximums is basically the insurance capping what they're going to pay. So some plans cover maybe $20,000 per lifetime or $10,000, or even give you a cycle limit, maybe 3 attempts per live birth. So it's very helpful to know what your maximum is to be able to utilize your benefits the best way. And one very important thing to consider with your maximum is if your medications are included in that maximum. So again, with the example, if there's a $15,000 lifetime maximum and your medications are included in that maximum, then you may actually exhaust all your insurance benefits before you even start treatment. So we strongly urge patients that have their medications included in that maximum to pay out of pocket for their medications and save their benefit for the treatment itself.
And even if you are lucky enough to have an insurance plan that covers treatment at 100%, some insurance may classify certain procedures as elective, even though it's medically necessary or a recommendation from your physician. A good example of that is egg cryopreservation. Insurance plans still view that as an elective experimental. So generally they won't cover any services related to that treatment option. We do offer financial packages that are significantly reduced for our patients without any type of insurance coverage, so we can definitely go over that if need be.
There are 15 states that actually mandate coverage for infertility treatment. Self-insured employers are not obligated to follow the mandate, and self-insured employers would be employers that pay all of the healthcare costs, not just the premiums. The infertility coverage is determined by the state where the employer's main office is located. Virginia, unfortunately, is not a mandated state. However, if you live in Virginia and you work in Maryland, then Maryland is a mandated state, and you may have coverage through your employer, unless they're, of course, a self-insured employer, and their main office must be located in Maryland. Also, if you wish to purchase individual coverage and you live in Maryland, then you may do so. Just keep in mind that you may have a higher monthly premium for that insurance, but it would be substantially less than paying out of pocket for fertility treatment or IVF.
Yeah, and not all plans are created equal. For example, you and your spouse may have a Blue Cross Blue Shield plan. One may cover treatment, the other one may not. One may have a higher, if both of them have coverage, then one may have a higher out-of-pocket responsibility versus the other. So those are definitely good things to understand and when trying to get your verification, your benefits. Also, something to keep in mind is knowing if your physician is participating with your insurance plan. There are some plans that don't cover any services that are rendered with a non-participating provider. So,
however, if we are out of network with your insurance, it doesn't mean that they're not going to pay anything for your services. It just means that you're going to have a higher out-of-pocket for the services as you would if you went to an in-network provider. And we actually have many patients that choose to pay out of network for our services if their insurance doesn't participate with our office. They actually choose to pay out of network, pay more out of pocket for services because they may have been referred by their friends, their family, or their physician. And I believe due to the personalized care that we provide to our patients.
Yeah, treatment alone is overwhelming, so we are definitely here to help alleviate some of the stress that comes to figuring out insurances. So please don't ever hesitate to contact our office. We're here for you.
Yes, and we hope we've been able to answer some of your questions and give you some insight into infertility coverage and treatment.
We actually have two questions. One is Washington, D.C. the region? Is it a mandated area for coverage?
Only Maryland's a mandated state in our
area. Okay.
Yeah.
And if a new patient calls in to Dominion Fertility, will they get assigned a specific financial counselor, or is it a team?
Well, we do work as a team, but you are assigned from day one with a financial counselor. If that financial counselor for some reason isn't available at the time that you call in, then certainly we all jump in and help you. Yeah.
Yes, we have very dedicated financial counselors here.
Great. All right. Well, thank you, ladies. This has been very helpful. I know you guys are very compassionate and caring, and it's just one small time that you gave to us today.
Thank you.
Thank you.
Thank you.
Thank you.